Yeah. So wide-angle viewing system using non-contact front lens has been widely accepted and used by vitreoretinal surgeons all over the world. But one thing which can spoil the entire show is the fogging. So the fogging happens over the undersurface of the lens because of the hot exhaled air from the patient escaping through the medial canthus region. So we traditionally use cotton plugs to block that, but it gets soggy and at times it doesn't work, especially in prolonged surgeries. There are, looking at the literature, there's one report published in Canadian Journal of Ophthalmology where authors have used a Foley's catheter. You can see the Foley's catheter here. So they used a suction apparatus to clear the fogging, but you need a specialized suction apparatus in the OT setup, and the suction is not controlled. This is another device published in Retinal, whereas you can see this device is customized for this particular front lens, which is ReSight, and it's not compatible with the other ones, and it also increases the volume of the lens, so you can't really maneuver the lens during surgeries. So we came up with this concept of why can't we use filtered air towards the lens and clear the fogging instantaneously. So that's how we came up with this idea. These are the components of the device. It requires simple aquarium air pump, and we need micropore filters and phaco tubing sets and long tubing of the vitrectomy set and additional phaco tubing set if at all required, and adapters. All these things are available in any vitreoretinal setup, OT setup. So it's a demonstration of our device. We use a simple aquarium pump to which this is a phaco tubing segment that we connect to the aquarium pump, and the other end of the phaco tubing set, using adapter, we connect to the micropore filters, 0.2 micron filters. We recommend two filters can be connected with each other like this, and then you connect it to the phaco tubing using adapter. To the other end, you can connect. This is the infusion tubing we have shown here dark tubing set. It can be directly connected to the micropore filter. If you're using the other, let's say Alcon Constellation, probably you might need one more segment and adapter here. And the other end can be simply kept over the nasal bridge towards a towards a front lens and not towards a cornea. So this is how we set up the device. In this photo you can see this blue portion is the other end of the infusion tubing set. This is the nasal bridge. So you can see that it's clearly directed towards a front lens, and the filtered air is just going to come, and it's not directed towards a cornea to avoid drying effect. So we demonstrate the device in real-time situation. You can see the fogging is quite significant. As we switch on the device, you can see it's going to get instantaneously cleared, and the effect is consistent. So now the device is started. Yeah, you can see the clearing effect in a matter of few seconds. So that's how it works. So the next concern is this device safe? Am I causing chance of increasing the chance of infection by doing this device because I'm blowing air towards it? So we validated our device against control. We did air sampling test using Seborrhoid dextrose agar. You can see this is from the antifogging device using two filters. This is from the OT control. We did it for did the sampling for 10 minutes, and after 48 hours we didn't really see any significant in the number of colonies or growth. So this device is probably safe as the control. So the advantages of the device: it's simple, easy to assemble, cost effective, and safe. The only disadvantage is it requires a little bit of more viscoelastics so that corneal drying to be avoided. And the stickers that we use to keep the end of the infusion tubing over the nasal bridge, sometimes it can get moistened, and that may result in misdirection. So that can be avoided if you can use 2 or 3 stickers over there. Thank you.
Thank you, Dr. Prabhu. Yeah, Dr.
Thank you.
Pillai, your comments, please.
Thank you very much, Prabhu. It was extremely good. It's a very important innovation that we need to have, because all vitreoretinal surgeons face this problem again and again and again, every surgery. But there are certain things. One is about the temperature fluctuations. Okay, whenever the theater, the number of people come in, or when there is some fluctuation in temperature, which happens in many theaters. So that can also induce this particular thing. And when this fish, this aquarium pump, that gets heated up after some time, maybe your surgery lasts for about an hour or so, and probably you'll have to use it again and again. So when it heats up, the temperature gets a little different. Yeah. And so the body temperature is like 37 degrees. Yeah. And then we will have this lens. Lens will be in room temperature. Yeah. And you will have this started up at one particular temperature, which is the room temperature. But then as we move on, there would be a change in temperature. Of that. Yeah. So how do you address that? Did you have that problems? Did you address that?
Yeah, we don't normally use this for, throughout the OT. We will require this for prolonged surgeries, especially when there is, the fogging is significant, so that the surgeon is not able to, proceed further. That's when we need it. Once the crucial steps are over, then probably you can, I would recommend that we switch it on and off during, as and when we need it, rather than keeping it on continuously.
Fine. Yes, please. Yeah. Just a quick comment, sir, please.
Number one, what was very important, the colony count which you showed. Second, using the nasal bridge. Both were points very well appreciated. And what Dr. Pillai mentioned is the temperature fluctuation. And also, what is more important, whether you are using a dehumidifier in the OT or not. That also adds to it, and the ambient temperature.
True.